OPSC Veterinary Assistant Surgeon Paper 1 Veterinary Science 2023-24. Question number 1. Seizure lasting for more than 5 minutes in dogs is generally termed as ictus, myoclonus, paroxysmal seizure, status epilepticus. And the correct answer is status epilepticus. A seizure lasting more than 5 minutes or a repeated seizure without recovery is called status epilepticus, which is a medical emergency. While other answers are not correct. Ictus, this refers to active phase of seizure, but it does not indicate prolonged seizure. Myoclonus, this refers to brief involuntary muscle twitches, not sustained seizure. Paroxysmal seizure, paroxysmal means a sudden attack, but it does not specify a seizure lasting longer than 5 minutes. So the correct answer is option D, status epilepticus. Question number 2. Polioencephalomalacia in ruminants is commonly associated with variation in thiamine status. The disorder can also occur with higher intake of option A, sulfur, option B, lead, option C, fluorine, option D, arsenic. The correct answer is sulfur. Excess dietary sulfur can lead to thiamine deficiency by altering microbial fermentation in the rumen, which results in polioencephalomalacia, PEM. But why other answers are not correct? Lead poisoning causes neurological signs but does not cause PEM. Fluorine, it causes fluorosis, which lead to bone and the teeth deformities. Arsenic, toxicity affects multiple organ system, but it is not a common cause of PEM. So the correct answer is option A, sulfur. Question 3. Slab-sided left lateral abdomen is a clinical finding in bloat, option B, left abomasal displacement, traumatic reticulitis, pneumoperitoneum. The correct answer is option B, left abomasal displacement. In short, it is called LDA. LDA causes abomasum to move to the left side between the rumen and the body wall, creating a sunken or slab side appearance. Why other answers are not correct? Bloat, this causes abdominal distension, not a slab side appearance. Traumatic reticulitis, it involves inflammation of the reticulum but does not cause a sunken abdomen. Option D, neuroperitoneum, this leads to free gas in the abdomen which may cause distension, not a slab side look. So the correct answer is this one. For slab side left abdominal, the correct answer is left abomasal displacement. Pathogenesis of fever is linked to sudden increase in prostaglandins. This increase is induced by interleukin 1, interleukin 2, 3 and 4. The correct answer is interleukin 1, which is a pyrogenic cytokine that triggers prostaglandin release in the hypothalamus leading to fever. Why others are not correct? Interleukin 2 mainly involved in the T cell proliferation, not fever induction. Interleukin 3 stimulates bone marrow but does not play a major role in fever. Interleukin 4 involved in allergic responses and B cell activation, not fever. So the correct answer is interleukin 1. Question 5. In the ECG, electrocardiogram, R wave in dogs denotes atrial depolarization, ventricular depolarization, atrial repolarization, option D, ventricular repolarization. And it is very easy. The correct answer is ventricular depolarization. Okay. Because the atrial depolarization, it is caused by P wave, not the R wave. Atrial repolarization also not. Okay. Ventricular repolarization also, it is caused by T wave, not the R wave. So the R wave of ECG in dog denotes ventricular depolarization. Question number 6. Normal level of blood glucose in adult cattle. It is very easy. It is 40 to 50 mg per deciliter. Okay. Normally what happens, cattle have lower blood glucose level because they rely on volatile fatty acids for energy rather than glucose. So the correct answer is 40 to 50 mg per deciliter. Question number 7. Falling disease in cattle is caused by thiamine deficiency, magnesium deficiency, cobalt deficiency, copper deficiency. The correct answer is copper deficiency. It will cause cardiac degeneration and sudden collapse leading to falling disease. Why other answers are incorrect? Thiamine deficiency causes polioencephalomalacia, not falling disease. Magnesium causes, we know, grass tetany, not falling disease. Cobalt deficiency causes anemia, poor growth, not falling disease. So the correct answer is option D, copper deficiency. Question 8. Hepatic encephalopathy in cattle is due to, very important question, increased bilirubin, increased ammonia, reduced blood glucose, reduced blood calcium. Answer is increased ammonia. When the liver fails to detoxify ammonia, it accumulates in the blood, leading to neurological signs that we are calling as hepatic encephalopathy. But why other answers are not correct? Option A, increased bilirubin. It will cause jaundice, not neurological symptoms. Reduced blood glucose. It will cause hypoglycemia, but not hepatic encephalopathy. Reduced blood calcium. It will lead to milk fever, hypocalcemia, not hepatic encephalopathy. So the correct answer is, so for hepatic encephalopathy in cattle, the correct answer is increased ammonia. Osteodystrophia fibrosa in goats is caused by dietary excess of calcium, magnesium, phosphorus, all the above. Very easy, the answer is phosphorus. Because excess phosphorus causes secondary hyperparathyroidism, leading to bone resorption and fibrous tissue replacement. Okay. So the answer is phosphorus. But why others are not? But why other answers are incorrect? Calcium, excess calcium does not cause this condition. Magnesium, imbalances affects nerve function, not bone structure. All the above, only phosphorus is the primary responsible. So the answer is not all the above. The correct answer for osteodystrophia fibrosa in goat is due to the excess of phosphorus, not calcium, not magnesium. Exudative diathesis in chicken is due to deficiency of, very easy, biotin, vitamin E, vitamin B1, manganese. The answer is vitamin E. Vitamin E deficiency causes oxidative stress and vascular leakage, leading to exudative diathesis in poultry. Why other answers are incorrect? Biotin deficiency causes dermatitis and foot pad lesion, not exudative diathesis. Vitamin B1 deficiency lead to neurological issues, not vascular leakage. Manganese, it will cause paralysis in leg deformity in poultry. So the correct answer of exudative diathesis in chicken due to deficiency of vitamin E. It is very important questions. Many times it is repeated in the OPSC exam. So be careful. Question 10 is very important. A very important question. 11. Pendice test is done to estimate the level of DAS in the cerebrospinal fluid, a fluid inside the brain. Neutrophil, proteins, lipids, glucose. Very easy. The correct answer is proteins. So Pendice test is a qualitative test used to detect increased protein levels in the CSF, which can indicate conditions like meningitis or multiple sclerosis. Why other answers are incorrect? Neutrophil, CSF neutrophil indicate bacterial infection, but are not measured by Pendice test. Lipid levels in CSF are not clinically relevant for this test. CSF glucose level are measured using a different biochemical test. Okay. So the correct answer is your proteins. Question number 12. Which is the insect-borne multi-species zoonotic viral disease of livestock? Blue tongue, African horse sickness, Rift Valley fever, brucellosis. And the answer is the Rift Valley fever. It is a zoonotic viral disease transmitted by mosquitoes and affects multiple livestock species including cattle, sheep. It will also infect humans. But why other answers are incorrect? Blue tongue, transmitted by midges but not zoonotic, only affects ruminants. African horse sickness affects horses but is not zoonotic. Brucellosis is zoonotic bacterial disease but not insect-borne. So the correct answer of the question 12 is Rift Valley fever. Question 13. Which of the following infections causes the most severe disease manifestation in infected dogs? Babesia canis rosi, Babesia gibsoni, Babesia canis vozeli, Babesia canis. The correct answer is Babesia canis rosi. Babesia canis rosi, found in Africa, is the most virulent strain and causes severe anemia, multi-organ failure, and high mortality in dogs. Why other answers are incorrect? Babesia gibsoni causes chronic milder infection with persistent anemia. Okay. But Babesia canis vozeli generally less severe and respond well to treatment. Babesia canis, a milder form found in the Europe. So the correct answer is your option A, Babesia canis rosi. Okay. 14. The number of new cases that occur in a known population over a specified period of time is known as periodic prevalence, point prevalence, incidence, attack rate. The answer is incidence. Incidence measure new cases over a specific period, helping track disease spread. But why other answers are incorrect? Periodic prevalence includes both new and existing cases over time. Point prevalence measures total cases at a single point of time. Attack rate, a type of incidence used in the outbreak investigation. Okay. So the correct answer is incidence. Question 15. The antigen used for the vaccine tick guard to control tick infestation is derived from tick saliva and hypostome, triturated whole tick chelicerae, tick gut membrane bound protein. The correct answer is tick gut membrane bound protein. Tick guard vaccine targets BM86 protein found in the gut lining of Rhipicephalus microplus ticks, reducing their ability to reproduce. Why other answers are incorrect? Tick saliva and hypostome used for allergic reaction but not tick guard. Triturated whole tick, not a specific antigen based approach. Tick chelicerae involved in feeding but not vaccine target. So the correct answer, the antigen used for vaccine tick guard to control tick infestation is derived from your tick gut membrane bound protein. Okay. The Christie-Atkins-Munch-Peterson CAMP test is used to identify which of the following mastitis pathogens: Mycobacterium bovis, E. coli, Burkholderia malai, Streptococcus agalactiae. The answer is Streptococcus agalactiae. The CAM test detect Streptococcus agalactiae, a gram-positive bacterium causing bovine mastitis. It enhances the hemolytic activity of Staphylococcus aureus. Why other answers are not correct? Mycobacterium bovis causes tuberculosis, not mastitis. E. coli, a common mastitis pathogen but does not test positive in CAMP. Then Burkholderia malai causes glandular in horse, not mastitis. The correct answer is your Streptococcus agalactiae. Question 17. Which of the following mycotoxins is nicknamed as vomitoxin? T2 toxin, aflatoxin B1, trichothecin, deoxynivalenol, DON. The correct answer is DON. DON is a trichothecin mycotoxin that causes vomiting and feed refusal in animals. Why other answers are incorrect? T2 toxin, a trichothecin toxin but not specifically vomitoxin. Aflatoxin B1 causes liver toxicity, not vomiting. Trichothecin, general class, but DON is the specific vomitoxin. So the correct answer is deoxynivalenol. Considerable thickening and corrugation of jejunum, ileum, ileocecal valve, and sometimes cecum is a characteristic postmortem finding in tuberculosis, paratuberculosis, rinderpest, coccidiosis. The correct answer is paratuberculosis, Jones disease, caused by Mycobacterium avium subspecies. Paratuberculosis lead to chronic thickening of intestinal mucosa. Why other answers are incorrect? Tuberculosis causes lung lesion, not thickened intestine. Rinderpest causes necrotic lesions, not intestinal thickening. Coccidiosis lead to hemorrhagic enteritis, not chronic thickening. That's why the correct answer is option B, paratuberculosis. 19. The type of epidemiology that involves observing and recording diseases and possible causal factors is called clinical epidemiology, analytical epidemiology, descriptive epidemiology, theoretical epidemiology. The correct answer is descriptive epidemiology C. It involves recording disease patterns, causes, and distribution without testing hypothesis. But why other answers are incorrect? Clinical epidemiology focus on patient care, not broad disease trends. Analytical investigate causal relationships through studies. Theoretical uses mathematical models, not real world observation. That's why the correct answer is descriptive epidemiology. Name 2 diseases combated by toxoid vaccine. Very easy, this one. Diphtheria, tetanus, anthrax, HS, tuberculosis. Answer is diphtheria, tetanus. Toxoid vaccines are made from inactivated toxins, tetanus toxoid, diphtheria toxoid, to protect against the diseases. Why other answers are incorrect? B, tetanus and anthrax. Anthrax vaccine is a live or a killed bacterial vaccine, not toxoid. Anthrax and HS, same reason above, because anthrax is there. HS and tuberculosis, HS uses bacterial vaccine, TB uses BCG, live attenuated. So that's why only your diphtheria and tetanus, they are the toxoid vaccines. So option A is correct. 21. Tigroid heart is a pathognomonic lesion in anthrax, brucellosis, FMD, enterotoxemia. Correct answer is FMD, foot and mouth disease. In FMD, the myocardium exhibits pale streaks resembling a tiger skin due to myocardial necrosis. This is called a tigroid heart, which is a characteristic lesion in young animals. Why other answers incorrect? Anthrax causes splenomegaly, hemorrhages, but not tigroid heart. Brucellosis primarily affects reproductive organs, not the heart. Enterotoxemia causes pulpy kidney disease, not myocardial lesions. Okay. The correct answer is FMD. So very important, remember, tigroid heart is a pathognomic lesion in FMD. Splenic fever is caused by Bacillus anthracis, Brucella abortus, Anaplasma marginale, Leptospira species. Answer is the option A, Bacillus anthracis. Splenic fever is another name for anthrax caused by Bacillus anthracis. It is characterized by enlarged dark spleen, sudden death in animals. So no need of further explanation. Very easy. Why other answers are incorrect? Brucella abortus causes brucellosis affecting reproduction. Anaplasma marginale causes anaplasmosis, a tick-borne disease leading to anemia. Leptospira species cause leptospirosis affecting kidneys and liver. So the correct answer for this is your Bacillus anthracis. Fertile lifespan of dog sperms is the reproductive tract of which is 12 to 24 hours, 24 to 48 hours, 2 to 3 days, 5 to 7 days. The correct answer is 5 to 7 days. Dog sperm can remain viable and fertilize eggs for up to 7 days in the female reproductive tract, making prolonged fertility possible. Why others are incorrect? 12 to 24 hours, too short for canine sperm survival. 24 to 48 hours, but will last much longer, 2 to 3 days. Underestimates the actual duration. So the correct answer is your 5 to 7 days. The condition in which a bulldog fetus is seen is hydroallantois, hydroamnios, anasarca, hydrocephalus. The correct answer is C, anasarca. Anasarca is a condition in which the fetus has severe edema, fluid accumulation in tissues, leading to a swollen bulldog appearance in some breeds like bulldogs and boxer. Why other answers are incorrect? Hydroallantois, excess fluid in the allantoic sac, not in fetal tissue. Hydroamnios, excess fluid in the amniotic sac. Hydrocephalus, enlargement of head due to fluid buildup in the brain, not generalized swelling. Okay, so that's why the correct answer is anasarca. 25. Remnant of the mesonephric duct system persisting in the vaginal floor of an adult female is hypoophoron, perophoron, Getner's duct, uterus masculinus. The correct answer is Getner's duct. Getner duct is a remnant of mesonephric Olffian duct that can persist in the female mammals and sometimes causes cyst formation. Why other answers incorrect? Hypoophoron, a remnant near the ovary, not in the vaginal floor. Perophoron, located near the broad ligament. Uterus masculinus, a remnant of paramesonephric duct in the male, not females. So the correct answer is Getner's duct. Site of production of glyceryl phosphorylcholine is vas deferens, seminal vesicles, prostate, epididymis. And the answer is the epididymis. GPC is produced in the epididymis and helps maintain spore motility and membrane stability. Why other answers are incorrect? Vas deferens primarily transports sperm. Seminal vesicle produce fructose, not GPC. Prostate produce prostatic fluid but not GPC. Substrate for endogenous respiration in spermatozoa is glucose, fructose, N-acetyl glucosamine, plasmalogen. Very easy, the answer is the fructose. 28. Developmental stage at which embryos are recovered during embryo transfer in cattle is 4-cell stage, early morula, gastrula, early blastocyst. Answer is early blastocyst. Embryo transfer in cattle is done at the early blastocyst stage, 6 to 8 days post-fertilization, because implantation has not yet occurred. Why other answers incorrect? 4-cell stage, too early for successful transfer. Early morula, still developing, not optimal for transfer. Gastrula occurs after implantation begins. So that's why the correct answer is D, early blastocyst. Species in which signaling by conceptus is not required for pregnancy maintenance is canine, equine, bovine, porcine. Answer is the canine. In dogs, the luteal phase length is same regardless of pregnancy. So conceptus signaling is not necessary for corpus luteum maintenance. But why other answers are incorrect? Equine. Equine requires maternal recognition of pregnancy via mobility of the embryo. Bovine uses interferon tau for pregnancy maintenance. Porcine requires estradiol from embryos to prevent luteolysis. That's why the correct answer is canine. 30. In free Martinism, vascular anastomosis occurs as early as on day 30, day 45, 60, 75. Day 45. Pre-Martinism occurs in cattle twins when the male and the female fetus share blood circulation via placental vascular anastomosis around day of 45 gestation, leading to masculinization of the female. Why others are incorrect? Day 30, too early for vascular fusion. Day 60 and day 75, vascular connection is already established earlier.